technician, also known as PCT, and if this is the right role for you. So let's begin with what is a PCT. So they're healthcare professionals that are trained to assist patients with daily activities and provide basic medical care. You'll work alongside nurses and doctors in hospitals, nursing homes, and other care facilities. So you're basically the person that assists them in any clinical setting that they're in, but you won't be doing a lot of the strictly clinical work, like let's say injections or any procedures, mainly just maintaining their quality of life during their stay. Some of the general skills that come along with this job include compassionate patient care and bedside manner, since you'll be working very closely with the patients. Strong communication and teamwork abilities, not only with the nurses and physicians, but also communicating with the patients. And lastly, knowledge of basic medical procedures, drawing blood, monitoring vital signs. These tasks that you're required to do will all vary based on the hospital that you're working with. Next are some general roles and tasks. So some of the key tasks begin with patient care. You'll be assisting patients with their daily living activities, such as bathing, dressing, and feeding, along with monitoring and recording vital signs, such as their blood pressure, heart rate, and temperature. You will also be assisting in clinical work for the nurses or the physician. So you'll be performing basic medical tasks like drawing blood and collecting lab specimens, along with setting up and cleaning medical equipment used in patient care settings. Next, you'll also be collaborating with the healthcare teams and working closely with nurses, doctors to ensure high quality patient care and just a great quality of life. You'll also be communicating patient concerns and observations to the healthcare team and generally just monitoring the patients that you're tasked with. Lastly, there'll be lots of documentation and you'll be required to maintain accurate records of patient care and progress. Now, how do you become a PCT? Where do you start? So first, check if you're eligible. You must be 18 years old, have a high school diploma or GED. You must have your CPR certification. This is something that you'll often get on the job or either trained in the course that you're doing. So this will come along with it. Also, make sure your vaccination records are up to date and match with the provider or clinic that you're trying to work for. Second, enroll in a PCT program or some similar nursing licensing program that will give you the experience and credentials to be a PCT. Now, there's a lot of flexibility in this compared to like an EMT role where there's a strict EMT course. For PCT, they're not always a strictly PCT class. Sometimes you can be a PCT with a CNA license. So always check with the provider that you are trying to work for. Typically, the program can last from either 1 month or up to 3 months. They can cost from $1,000 to $3,000 and includes both clinical hands-on training and classroom instruction. Next, if you do obtain a certification, make sure that it is with a recognized organization or nurse agency. And the exam fee will typically range from $125 to $200. And you'll have to be renewing the certification every 2 to 3 years, again, depending on the state and hospital provider that you're working out of. Lastly is just employment. You'll be applying to hospitals, nursing homes, and outpatient clinics in your area, and you will most likely be able to find a great stable job. And then you'll be starting your role as a vital member of their healthcare team for the patients and for the nurses and physicians around you. Let's dive into a couple of challenges and rewards that inherently come with any job, but specifically PCT. So some of the challenges, it can be very physically demanding because you are assisting patients with mobility and personal care, which does require a certain amount of physical strength and stamina. This is all something that you will be trained on prior, either at the job or in a course. And it can also be emotionally taxing since you're providing care for patients in difficult or end-of-life situations, which can simply be emotionally challenging, especially in situations where you're working in terminal care facilities, the ICU, or nursing homes. You are working very closely with those that are in end-of-life situations or simply there is no specific cure. Now, moving on to some rewards. Number one, there's high job security because there's a really great demand for PCTs in different settings, including hospitals and nursing homes. So, if you do move from one state to another, you'll tend to be insured a PCT position anywhere that you go, as long as you're close to any of these facilities. This is also gratefully impactful work. You're playing a vital role in improving patients' comfort and quality of life, and this can be incredibly fulfilling for anyone involved. Lastly, obviously, direct patient interaction. You're building meaningful connections while providing hands on care and directly working with the patient that you're tasked with, along with the clinical team, such as the physicians and nurses. Lastly, some additional resources if you still like to learn more. We have summary sheets that give an overview of each clinical role. We have a detailed document with specific trainings and hospitals in each state of your interest, for example, California or Michigan. And lastly, email, DM, or reach out with any additional questions you may have.